Now that we understand what memory loss is, let's explore the different types. Memory loss can be classified in several ways, and understanding these categories helps us identify causes and find appropriate solutions. A. Classification by duration. First, let's look at classification by duration and which aspects of memory are affected. Short-term memory loss refers to difficulty holding on to information for brief periods, typically seconds to minutes. If someone tells you a phone number and you can't remember it long enough to dial it, that's a short-term memory problem. This is closely related to what we call working memory, which is like your brain's mental workspace. It's what allows you to hold information in mind while you manipulate it, like doing mental math or following a conversation while planning your response. Long-term memory loss, in contrast, affects information that should be stored more permanently, things you learned hours, days, months, or years ago. This might include forgetting significant life events, losing knowledge you once had, or not recognizing people you've known for years. There's also an important distinction between recent and remote memory. Recent memory involves events from the past few hours to days, what you had for breakfast, or what happened in yesterday's meeting. Remote memory involves the distant past, your childhood, your wedding day, or where you went to college. Interestingly, in many degenerative conditions like Alzheimer's disease, recent memory tends to fail first, while remote memories remain relatively preserved. This is why someone with dementia might not remember what they did this morning, but can vividly recall events from their childhood. B. Classification by onset and progression. The second way to classify memory loss is by how it begins and how it changes over time. Sudden onset memory loss happens abruptly, often due to a specific event. A stroke can cause immediate memory impairment when blood flow to memory-related brain areas is interrupted. A traumatic brain injury from a car accident or fall can result in instant memory loss. Even transient global amnesia, a mysterious condition we'll discuss shortly, appears suddenly. In contrast, gradual or progressive memory loss develops slowly over time. This is characteristic of degenerative conditions like Alzheimer's disease, where brain cells progressively malfunction and die. The changes might be so subtle initially that they're dismissed as normal aging, but over months and years, the decline becomes unmistakable. We also distinguish between transient and permanent memory loss. Transient means temporary. The memory impairment resolves. This might happen with a concussion, where memory problems improve as the brain heals, or with medication side effects that reverse when the medication is stopped. Permanent memory loss means the memories are gone and won't return, though the person may stop losing additional memories if the underlying cause is treated. C. Classification by cause. Perhaps the most practical way to think about memory loss is by what causes it. Let's walk through the major culprits. Age-related memory decline is something virtually everyone experiences to some degree. As I mentioned earlier, this is normal and doesn't significantly impact daily life. Your processing speed slows. You might need more time to learn new information, and recall isn't as quick as it was in your 20s, but you can still function independently and continue learning. Mild cognitive impairment, or MCI, is a step beyond normal aging, but not quite dementia. People with MCI have noticeable memory problems. They might forget appointments, repeat stories, or struggle to find words more than age alone would explain. However, they can still manage daily activities independently. About 10-15% of people with MCI progress to dementia each year, but some remain stable and others actually improve. Dementia is the umbrella term for severe cognitive decline that interferes with independence. Alzheimer's disease is the most common form, accounting for 60-80% of cases. It's caused by abnormal protein deposits in the brain, beta amyloid plaques, and tau tangles that damage and kill brain cells. Memory loss, particularly for recent events, is often the first noticeable symptom. Vascular dementia is the second most common type, caused by reduced blood flow to the brain from strokes or small vessel disease. Unlike Alzheimer's, which progresses gradually, vascular dementia may worsen in a stepwise pattern, with periods of stability interrupted by sudden declines when new strokes occur. Other forms include Lewy body dementia, frontotemporal dementia, and mixed dementia, where multiple pathologies coexist. Traumatic brain injury, or TBI, can cause memory loss when the brain is jolted or struck. The severity depends on the force of impact. A mild concussion might cause brief confusion and temporary memory gaps around the time of injury. Severe TBI can result in profound, lasting memory impairment. Medications are surprisingly common culprits in memory problems. Benzodiazepines used for anxiety or sleep, anticholinergics found in many over-the-counter medications, certain pain medications, and even some blood pressure drugs can impair memory. This is particularly problematic in older adults taking multiple medications. The good news is this type of memory loss is often reversible when the medication is stopped or changed. Stress and anxiety can significantly impact memory, even in otherwise healthy people. When you're stressed, your body releases cortisol, which in high levels can interfere with the formation of new memories and the retrieval of existing ones. Have you ever gone blank during an exam, even though you studied? That's stress affecting memory. Chronic anxiety keeps your brain in a heightened state that diverts resources away from memory consolidation. Sleep deprivation is another reversible cause that's endemic in modern society. During sleep, particularly deep sleep and REM sleep, your brain consolidates memories, transferring them from short-term to long-term storage and strengthening neural connections. When you don't get enough quality sleep, this process is disrupted. Even one night of poor sleep can impair memory formation, and chronic sleep deprivation can cause persistent memory problems. Nutritional deficiencies can also affect memory. Vitamin B12 deficiency, particularly common in older adults and vegetarians, can cause memory impairment that mimics dementia but is reversible with supplementation. Thiamine deficiency, often seen in chronic alcoholism, can cause severe memory problems including Korsakoff syndrome. Even dehydration can temporarily impair cognitive function. D. Specific syndromes. Finally, let's look at some specific memory loss syndromes that have distinct characteristics. Anterograde amnesia is the inability to form new long-term memories after the onset of the condition. People with anterograde amnesia can usually remember their past just fine, but they can't create new lasting memories. Every few minutes, it's as if they're waking up fresh. They might introduce themselves to you repeatedly because they don't remember meeting you moments ago. This is seen in severe Alzheimer's disease and can result from damage to the hippocampus. Retrograde amnesia is essentially the opposite. It's the loss of memories that were formed before the onset of the condition. Someone might forget events from recent years or, in severe cases, even their own identity and life history, while still being able to form new memories. This can occur with head trauma, stroke, or psychological trauma. Transient global amnesia is a fascinating and still somewhat mysterious condition. It typically affects middle-aged to older adults and comes on suddenly. For several hours, the person is confused and disoriented, repeatedly asking the same questions because they can't form new memories. However, they can still perform complex tasks like driving, though it's not recommended. The episode resolves completely within 24 hours, usually leaving a permanent gap in memory only for the duration of the episode. We don't fully understand what causes it, though it may relate to temporary disruption of blood flow to memory areas or a migraine-like phenomenon. Understanding these different types of memory loss helps us recognize that memory impairment isn't one size fits all. The pattern of memory loss, what's affected, how it started, and how it's progressing provides crucial clues about the underlying cause and the best approach to treatment.